our webinar
Recording
today.
in progress.
I'm Rhonda Smith, the Executive Director of the California Black Health Network, and welcome to the first of a 5-part series on making the healthcare system work better for you. We are able to bring this important series to the community through the support of the California Healthcare Foundation, and we are very fortunate to be a partner and collaborator with the foundation to implement one of the recommendations that came out of their listening to Black Californians research, which is a project that was designed to understand what happens when Black Californians interact with the healthcare system and what that experience is like for them. That specific recommendation is focused on health education and has evolved to what is now called the How Do I campaign. So really intended to answer basic questions about how do I do anything I need to do when I'm trying to get the healthcare I need or interact with the healthcare system. So this How Do I initiative and campaign really is to provide knowledge, skills, tools, and resources to empower Black Californians to take charge of their health and healthcare and own their power when interacting with the healthcare system. So we're launching this 5-part series as the first activation as part of the How Do I campaign. And so overall, the California Black Health Network works to advance health equity for Black Californians, but we're also working to ignite a Black health movement here in California to create a more empowered community of individuals and patients to become more proactive about their overall health, well-being, and focus more on prevention, take ownership of their health care. And so today's session is focused on knowing your patient rights. And we need to know, first of all, that there is such a thing as a patient bill of rights, and that we need to know how we can exercise our rights as a patient to get the healthcare we deserve and to make the healthcare system work better for us and be responsive to our needs. And so we are delighted to have as our subject matter expert for today, Dr. Glenda Newell-Harris, who is the author of Focus on Your Best Health, the Smart Guide to the Healthcare You Deserve. And so the first 25 people who registered and also showed up today will get a copy of Dr. Glenda's book. And so we'll work with you after the event today to make sure that you get your copy mailed to you. But before we start the program, I'd like to cover just a few housekeeping items. And so, well, first, I'll give a quick overview of the California Black Health Network for those of you who may not be familiar with us. Then we'll hear from Dr. Newell-Harris, and we'll have a session for you to ask questions of her. And so please remember to put your questions in the chat box. You're welcome to give a shout out to folks that you recognize that are in the webinar today in the chat box. But if you have any questions, just make sure you put those in the Q&A box. And so again, before I start, or before Dr. Newell starts, I just want to give a quick overview of the California Black Health Network. So we are the voice and trusted resource for Black health equity here in California, and we are the only Black-led statewide organization dedicated to advancing health equity for all African Americans and Black immigrants here in California. And we do a lot of that work through outreach, education, advocacy, and policy work to advance health equity for Black Californians. And we focus on that through the lens of understanding the critical issues that lie at the intersection of racial justice, social justice, and environmental justice. And so our main focus and direction through our vision and mission is we would love to see a California where every African American and Black immigrant has the opportunity to live a long, healthy life that's free from violence, racism, and health inequities. So we work every day through our mission to realize that vision, to ensure that all Black Californians, regardless of how well educated they are, how much money they make, where they live, how they identify, who they love, what their housing status is, and even where they're from, has the access to high quality and equitable primary as well as behavioral health care, and definitely avoid unnecessarily succumbing to any type of disease. And so I'm happy to present to you Dr. Glenda Newell-Harris today, and she will be our keynote speaker. Dr. Newell-Harris has a stellar reputation in the healthcare industry, and she's joined us today from her home in Oakland. She is a physician with Yes Care and has had numerous positions nationally. Some of you may recognize her. I won't spend a lot of time talking about her. I'll let her share a little bit more about herself, but I know that she left home at the age of 16 from her home in North Carolina to pursue her dream of becoming a physician. So she's been a huge advocate for patient rights, for patient advocacy, and to make sure that we all get the health care that we deserve. So Dr. Newell-Harris, I'll turn it over to you if you'd like to share a little bit more information about you and your background and your passions. So thank you very much for being here.
Sure. Thank you so much for having me. I am so excited to be here today. And greetings to all of you that have taken time out of your very busy schedules to join this webinar. This is really sort of a landmark opportunity. And I'm so proud to be in the great state of California, and to be partnering with the California Black Health Network to focus in an area that has been a passion of mine for so long. I actually, a little bit about my background. I was born and raised in the state of North Carolina. And at a very early age, elementary school, I decided I wanted to be a doctor. You might say, well, how did that come about? But as you know, you sort of set goals for yourself, and then you have to kind of grow into them. And but I love science. I was very fascinated by medicine, and the only medicine I knew was the medicine that I saw on television, the Dr. Kildare and Ben Casey. And I know I'm dating myself by sharing that. But then I also have this passion to be able to help people. And as I proceeded into that journey of becoming a doctor, and once I became a doctor, and then once I also became a consumer of the healthcare plan, it was crystal clear to me that there were some gaps and that people needed help. And so for probably the first 10 or 15 years of my early career, I served in the gap for people, making phone calls, trying to understand what was going on with grandma in Mississippi or grandma in New Haven, to understand what was happening in terms of their healthcare, because people didn't really understand. And after doing this for so long, my co-author and I, Dr. Brenda Spriggs, just felt maybe we should put this information in a book. And so today we're going to focus on your patient rights. And you might say, well, why are we focusing on patient rights? Well, because it's very important that you need to understand that you have rights. You actually do have rights as a patient. You may feel that when you're in a medical situation that, you feel like you're sort of at the mercy of everybody that's there. But even in that process, you do have rights. And specifically, I know that this is the California Black Health Network. And I do feel compelled to mention that I do have the honor and the opportunity of being appointed to the advisory committee for the Office of Minority Health by the president. And so this just rolls right into my passion of speaking to groups of color, because we often are the ones that are disenfranchised, don't really understand. So I'm delighted that all of you have joined. And without further ado, we're going to move right in to what we're going to address today. So Rhonda, I'm actually noticing I'm not able to advance this slide.
So not sure, that would have to be on your end. Can you hit like the page down button on your end and see if that works instead of I think you're trying to click your mouse?
No, I'm actually doing my arrows, which usually work.
We can see your whole desktop, so maybe you want to stop sharing and then reshare again.
Okay.
Yeah, make sure that it's in slideshow mode.
Yeah, it definitely is in slideshow mode. So let me try again.
No worries.
Let me try one more time here. Is that showing the presentation now?
Yeah, that looks better.
That looks better, yes.
Okay, here we go. Oh, something happened. Okay, I apologize for that. So this just tells you a little bit about me and the book that we co-authored. And let's just kind of get on with the show. So why do we have patients' rights? We have patients' rights because it's important for you to know, first of all, that you have some say-so in this matter. And from a standpoint of goals and objectives, the patients' rights were created to help build trust and confidence within the healthcare system, to strengthen the bond between you and your healthcare provider, and also to empower you to take charge of your health. And you're going to hear that sort of as a recurring theme about taking charge of your health, because in this journey of taking care of yourself, a lot of it is going to have to do with you. Why is this important? Well, it's important because respecting patients' rights is paramount in building that trust between the patient and the medical professional. I don't know if any of you have ever been in a situation with a provider and you somehow felt dismissed or not heard. But it has been proven that if there is that trust, that also we have better patient outcomes. Are these rights legally binding? Not really. They are simply guidelines, but it is important for you to know that you have these rights as you travel on your medical journey, so that you're able to be empowered to know when and where to ask the right questions. So how did patients' rights come about? Well, back in about 1973, the American Hospital Association created the first Patient Bill of Rights. And the intent of that was to be able to address the relationship that the patient would have when they were hospitalized patients. But then over time, it evolved, and states and healthcare organizations began to expand these rights. And then ultimately in 1997, President Bill Clinton established a commission that has a very, very long name. We don't need to know a lot of details about that. But from that commission, it was determined that we would have a Consumer Bill of Rights. And so today we're going to talk specifically about each one of those rights, how they might have an impact on you and your care. And as we travel down this journey of discussing each one of these rights, I want each one of you to just try to pause and reflect on an experience, a situation, a medical encounter that you may have had with your primary care physician or with your nurse practitioner or with a specialist, and see if you are able to relate to whether maybe knowing in advance that having some of these patient rights in your armamentarium perhaps would have put you in a situation where you would have been more empowered to ask that question to the provider rather than to go home and ask that question to your family, or find your family asking you that question when you go home, and then you shrug your shoulders thinking, oh, I don't know, either I forgot to ask or I was too intimidated to ask. Let's talk just briefly about HIPAA. I'm sure that many of you have heard about HIPAA. HIPAA has been around now since about the year 2000. And why is HIPAA important? Well, HIPAA is important because really, honestly, for patients, it's a wonderful thing. But oftentimes for those of us that are trying to stand in that gap between you and your doctor, it can become an obstacle. Back in the old days, I used to be able to pick up the telephone and call any hospital in any state, in any city, and identify myself as Dr. Newell and a friend of the family's, and give the name of the patient and say, you know, I'm calling to find out how Mrs. Jones is doing in bed 2. And I might know the diagnosis, and I want to speak with the provider, just to get more detail. And I might ask to speak with the doctor, and I would, without question, get a telephone call back from the doctor. It was kind of that doctor to doctor thing, and the doctor would speak to me and we'd communicate about the patient, and then I would go back to the family, and then we'd have a conversation. And 100% of the time, every single family that I was representing felt better about the experience, better understood what was going on, had all their questions resolved. Well, guess what? When 2000 came, that stopped. Because doctors can't speak to people unless you as the patient give them permission. So I say to those of you that are on this call, if you have loved ones that you want to be able to get feedback about what's going on with you, it is critical, it is paramount. I suggest and recommend to you that you need to tell the doctor that and have it placed in your chart in a prominent place, that it's okay to talk with John, my son, or Mary, my daughter, because there are times when you make a decision that you don't want medical information to go to individuals. And oftentimes when you are ill, those individuals might be the ones that show up and want the information. So HIPAA has been a great thing in order to be able to provide you with confidentiality and the access to your own medical information. And then in 2010, the Affordable Care Act came along, and with the Affordable Care Act came many, many, many more rights that have been made available to help to make our treatment to be even more fair. Many of you on this call, I'm sure, know a lot about this already, but I'm just going to touch on a few of them just in case they have not been things that you've actually had to know. One of them in particular that rings true to me is that under the Affordable Health Care Act, you are able to have your children, your young adult children, to remain on your health care plans. And I have to say, I'm a testimony to that. My children were under that age at the time that this came out, and it was great to be able to have your college age students or graduate students who might not have another opportunity to get insurance and may have aged out prior to. So being able to keep younger adult children under your health plan was an asset to the Affordable Care Act. Providing coverage to individuals that may have pre-existing conditions was another asset to this Affordable Care Act. Giving you a choice of providers, no longer having lifetime limits on coverage, allowing you to be able to even some children with pre-existing conditions were excluded from certain healthcare plans. So these are just some of the very, very few things that were offered in the Affordable Health Care Act. And I encourage you to go back and take a look at that because there may be some things there that may actually ring true to you. And so now we're going to jump right in to the key areas of patient rights. And we're going to go over each one of these individually. Clear information or information disclosure. I will say to you that it is clear information, but in reality, when this paperwork is coming at you, it will say information disclosure. So I specifically wanted to leave this on this slide so that you would become familiar with that term. Choosing your provider, emergency services, participating in treatment decisions, respect and non-discrimination, confidentiality of health information, the ability to be able to register a complaint and the appeals process, as well as your own responsibilities. So let's chat for just a little bit about information disclosure. Now, you have a right to receive clear, understandable information about your health, your healthcare plan, the management, and the treatment. You have the right to have information about healthcare providers that are in the plans that you choose, and there are several hundred of them. Thus, the importance of the Bill of Rights, because it helps to also have all of the different insurance plans at least be accountable to some basic fundamental guidelines. You also have the right to know about the education of the doctors that you are seeing, whether they are board certified or not, whether they accept new patients or not, and what languages they may speak. You have the opportunity to get information about how many years they've been in practice. And then let's go on to the next slide. Let's talk for a little bit about guidelines from the federal and the state perspective. Each state many will have their own guidelines around their managed care plans. And so you have a right to be able to get that information. You have a right. How many of you have walked out of your doctor visits and almost before you can get home, there's a patient survey in your inbox? Well, they want to know how the visit went, and they take that information and they utilize that information, and you have the right to be able to get that information if you want it. I mean, it's sort of like, when you're going and buying something online and you look to see if it has 3 stars or 5 stars. you may want to know. You know, when I was in private practice, I used to always say that the best referral for a patient as a physician was from another patient, not necessarily from another doctor. When I was a young physician, I used to always get referrals from other doctors because I wasn't known. But when another patient refers you to a doctor's office, then that's real firsthand experience. And so patient information is important. Patient experiences are important, and healthcare plans are listening to what you are placing on those surveys. You also have the right to understand what is covered and how things are covered. And you might say, well, how do I figure that out? Well, if you look on the back of your insurance card, there may be something that says member services or customer service. If there are any questions that you have about what may be covered because you don't want to take the time or have the time and you're not at a laptop to log in and go through the pages and pages of information that may share it, you can pick up the telephone and call and get that information. You are also eligible to know about primary care and specialty providers that are on staff. And as well as we discussed, provider names and credentials. Now, I did see in my research that this says that you are entitled to know providers' compensations. Well, I have to tell you, I wasn't able to find that anywhere, but maybe there are some documents somewhere where there are ranges of maybe understanding and knowing. But quite frankly, I have to tell you, for all the years I've practiced, I have no idea what the pulmonologist makes versus the cardiologist versus the primary care. But I will tell you, those folks that are doing primary care medicine, the internal medicine folks, the pediatricians, the family practice, they are the lowest on the totem pole for the compensations. And that's just kind of an aside or as a fact for you to be aware. What information is available to you about providers? You are entitled to know what hospitals that a provider has where a provider has privileges. I mean, for goodness sakes, you may love Dr. Smith, but if you live in Oakland and Dr. Smith only has privileges in Livermore, you may want to think about whether you want to see Dr. Smith or how you're going to be able to make a beeline out to that Livermore hospital if you've got an emergency. You have the capability of knowing about their experience in performing medical and surgical procedures. Now, I'm going to divert here for a quick second and go into some of the things that I share when I do subsequent presentations. We're going to be talking on other webinars about effective communication, savvy navigation, which leads to appropriate advocacy. And one of the things that I often share when I'm coaching and counseling individuals that want to be their best advocate, I always suggest that when you're getting ready to go for a surgical procedure, it's okay to ask the surgeon, how many of these have you done? And how many do you do a week? I mean, honestly, if, I want the surgeon who might be taking out my appendix to have removed maybe, depending upon his or her age, several hundred or more. I'm not inclined to be so excited about having my thyroid removed by someone that just got started. There are a lot of structures up there around the thyroid gland, in most of all the recurrent laryngeal nerve, that can impact your ability to speak and hoarseness. So it speaks to the fact that, it's just like your mechanic. You want somebody working under your car that understands a Chevrolet or a BMW or a Ford. And of course, I don't know much about cars, so maybe if I knew more, maybe somebody that works on Fords and Mercedes and BMWs can do it all. But that's why oftentimes they say, oh, bring it back here, because we're the Ford dealership or we're the Chevrolet dealership. So, but you have the right, and you should ask those questions. Now, about the facilities, again, we're going to just comments a little bit about customer satisfaction and their clinical quality. I mean, does this hospital have a reputation for having a lot of infections? You would want to know that. You don't want to leave the hospital with more diseases than what you came there with. And there is that old phrase that when you get sick and you go in the hospital, You want to get in and get out as quickly as possible because there are a lot of sick people there. And you want to get in and get out so that you don't end up being that person that may end up contracting something from perhaps infection control not being at its best. And then lastly, but not necessarily any less important, how do you address concerns that you might have? And you have the right to do that. You have the right to file a complaint. You have a right to express your concern about inappropriateness in an encounter with a medical provider, inappropriate delay of getting an appointment scheduled. All of those things, you absolutely have the right to be able to address, and I encourage you to do so. Because, you know, it's sort of like, I'm sure you've heard this in many other experiences, that people that work places will say, well, you know, when I say something about it, it doesn't matter. But if you as the customer speak up about it, that's how we get things to change. So I encourage you, don't go home sad and tell your family, you know, this didn't happen for me or that didn't happen for me. If you feel like any one of these things that we've already addressed is not being addressed in your encounters with your medical providers, you do need to do that, because guess what? You're also helping out the next person that may not have the energy, the stamina, because, you know, it's really hard to complain when you're sick. It really is. When you're sick, all you can do is just kind of gather up what you need to get to that appointment, listen to what the information the doctor or nurse practitioner is going to share with you, and then go home and try to digest it all. And you're probably trying to digest whatever the news is. You're certainly not thinking about the disrespect or the lack of the provider not answering your questions, or you're just trying to handle what you've got. So from that standpoint, I encourage you, bring somebody with you to the doctor. Bring a friend or a family member that might be able to help ask some of these questions of you, especially if you are already just worn down and beaten up from whatever the medical condition is that you are struggling with at that time. Choice of providers. So I have all of these managed care plans here, and I want to say none of them is paying anything, I don't think, the California Black Health Network. So just pretend that, you know, they are just here as sample logos. But you have your choice of providers. You have that right. And when you sign up through your plans that are generally through your employers, you have the right to be able to pick one or the other. I encourage you to take time and look at those plans. You know, the information, again, I date myself, but, you know, history helps you be able to have more than gray hair. That used to be in many companies, and maybe some still do it, that when it was open enrollment, you know, there were all kind of people that would come to the facility and they talk to you, and you could meet with them and sit down and have a conversation. They would discuss with you. Now, you know, who in your family are you trying to cover? And sometimes you would need to make decisions based on how many family members or how sick people were. Do you want, you know, a higher deductible? Because, you know, you think you're going to be okay, or do you want a lower deductible and just higher premiums? But nowadays, many times open enrollment is an email with the dates, and some companies will have a concierge service where you can pick up the phone and call and speak with someone. But I can certainly say over my entire professional career, that has not been the case. And it's been up to me to sit down and plow through that and try to figure it out. So if you're changing plans and you love your provider, it's important for you to call in advance and find out, if I'm going to switch from plan A to plan B, I need to find out if provider so-and-so is on these same plans, because if that provider matters to you, you want to stick with them. So you do have a choice, but it is a choice within the realm of whatever the plan is that you choose for yourself. The next thing I want to talk about is access to emergency services. Now, I know many of you, and I'm going to say us, Because again, like I've told you, I've been a patient. I am a patient. You know, if you stay around this world long enough, you're going to be somebody's patient. Just trust and believe. So many times we take situations, and if we don't address them if we don't make appointments with our regular docs, sometimes we find ourselves in a situation, and it's always after 5 o'clock on Friday and before 9 o'clock on Monday. It always is. It's just the way it goes. So we think that we can then go off to the emergency room for care. And you can, but let you know that in the emergency room, these cases will go ahead of your ear pain, gunshot wounds, chest pain, abdominal pain, stabbings, head injuries. They are true emergencies. And so that will get ahead of you. And that's why often you will say, I went to the emergency room and I sat for 10 hours to get seen for my sore throat. So, you know, over the years, healthcare plans have developed these urgent care facilities. So that's sort of helping to get non-emergency cases out of emergency rooms. But it is important for you to know that you do have the right to access to emergency services. And I encourage you to use it. Chest pain is not something you want to say to your family member, well, let's go get in the car and go for a ride to the hospital. I wouldn't. You need an ambulance for that. Head injury, same thing. Gunshot, stab. I would be careful even with abdominal pain, depending upon how long it's been going on. So you just need to know that you have the right to those services, and it is part of your plan, and it is often mentioned in your plan. And I'll give you one other little tip, and you probably know this too already, but there's a copay for emergency services. But if you get admitted, oftentimes that copay is waived. Well, don't let that $50 or $75 be the deciding factor as to whether you take yourself to the emergency room or not. If you really think you need to go, you absolutely need to go. Many things present in very subtle ways that can be very, very serious. And so you want to be able to get to a hospital that has urgent and emergent care. Now, on that note, and we'll talk a little bit about this when we talk about navigation, but you need to know where the centers of excellence are as it relates to emergency care. So if you're having chest pain, and again, sometimes the ambulance will determine where you're going because they're not going to want to drive you, 15 miles if there's a closer hospital. But you want to know where the centers of excellence are for cardiac and where the centers of excellence are for stroke. You wouldn't want to go to a hospital that doesn't have a stroke center if you think you have stroke symptoms. And I'm going to say that's part of your journey. You should know in the communities where you live, where's the stroke center? Who does the cardiac surgery? What hospitals do that? You just want to know who's got a head injury facility, who can handle that. Some of the smaller hospitals in smaller areas may not have all of those resources. And if you get there and you need to be transferred, of course, you can be transferred. But it's important for you as a consumer to know this information before that type of situation presents itself. This next right talks about participation in treatment decisions. Now, I sort of feel like in previous years, you used to go to the doctor and you would explain your complaint and the doctor would listen, and the doctor would then tell you, this is what you have and this is what we're going to give you. And we all took those prescriptions and we thanked the doctor and smiled and walked away. And for many conditions that we had, that was perfect. But as medical research has advanced, there are often many different ways of treating a problem. And often the more complex the problem, the more treatment options that may be available to you. And so rather than a doctor talking at you, we want the doctor and the nurse practitioner to talk with you and help you to be a part of the decision-making around the treatment that you are going to get for a particular problem that you have. Again, this is an area where you have a right. You need to remember to be empowered, that you can raise your hand and say, and this has happened, I've had this happen with friends and family, that a friend would have a medical problem, they'd be treated one way. Another friend would have the same medical problem, though we don't know all the details, and that person was treated the other way. Well, the two friends got together and they found out, well, wait a minute, wonder if I could be treated with this other modality. And this is a true story. And in this situation, this particular person's healthcare plan told them, we don't offer that. But the patient went back and was persistent. And the healthcare plan found a place to allow that patient to get that treatment. And sometimes it's out of network. I don't know whether they had to pay additional money because it was out of network, but the bottom line is they were able to get the treatment plan that they wanted. And ladies and gentlemen, those of you that are here on the call, I know that there are times when you look up and say, because I say it, oh, I'm paying so much for that premium. And oh, I'm paying so much. There are copays left and right. There's always something that's not being covered. But you can't put a price tag on your life. And so if you find yourself that you've got to make a little extra payment, that's one less Starbucks you might have to get that week. But you must invest in yourself and in your health care, and taking care of your health from the standpoint of all the things that we'll talk about as we move toward the end of this presentation. But sometimes you are going to have to write a little bit larger check, because sometimes everything is just absolutely not covered. Respect and non-discrimination. I can guarantee that every single person on this call could probably give me an anecdotal story of how they may have felt disrespected in some type of a medical encounter throughout their lives. And the research supports discrimination in women, discrimination with people of color, discrimination amongst people that may not be able to read and write. And so there's all kind of discrimination. They talk about women going into the emergency room complaining of chest pain. I think people are on to us now. But it used to be when we would come into the emergency room with chest pain, the emergency room doctors would say it was stress. And, they just didn't think that our chest pain was chest pain that was cardiac in nature, because our symptomatology was different. In other words, we weren't giving a classic story. It wasn't crushing. It wasn't midline. It didn't radiate to the left arm or jaw. We didn't necessarily have an elevated blood pressure associated with it. It may not have even responded to nitroglycerin. And so therefore we get dismissed. But guess what? The research has shown that women have significant cardiac disease, and our presentations are different. And I think many of our emergency room doctors now over the years are onto that, because research has supported that. But respect comes in all kinds of ways. Respecting that you have a brain, that you can ask questions. Don't mistake the fact that I rolled up into this emergency room in my jogging clothes that I may not be a professional. Don't mistake that. And so we must demand respect in our visits. We again will talk more in subsequent webinars about communication and how communication is so important, and respect is very much a part of communication. And let's face it, if you're in a doctor's visit or you're in a medical encounter and you feel that you're not being respected, you don't hear what the doctor says to you, and you don't listen to what the doctor says to you, and you definitely will have questions about whether you're going to follow his or her instructions, because you don't feel that you're respected. And so if you don't feel respected, there's not a lot you can do in an emergency room visit because you're sort of there to see whoever's there. But there are a lot of things that you can do when it relates to your primary care relationship, because that relationship with that primary care doctor, that's long term. You're in that for the long haul. So you ladies and gentlemen, we need to be buddies with our primary care doctor. And there needs to be a mutual respect. We have to also understand that when we send notices to doctors, they're hearing from multiple other people. So if they didn't get back to you in 30 minutes, it's okay. Unless it's life-threatening, and if it's life-threatening, you should be on your way to the hospital in an ambulance. But again, we have the right to be treated with respect and without discrimination based on race, creed, religion, sex, age, sexual proclivity, physical disability, genetic information, or source of pay. Confidentiality of health information. Now, we talked a little bit about this earlier, but it is important that your health information remain between you and your treating provider. You should not be hearing about your medical problem from the neighbor because the neighbor's daughter works at the health facility. This confidentiality goes across the board. The only people that really should be talking to others about your health are the specialists that have been referred, that you have been referred to. So it's okay for your primary care doctor to talk to your cardiologist or vice versa. But your information should be protected, and in no way should it be disclosed to anyone without your permission. Complaints and appeals. So if after you've dealt with all of these other things, and you and your family members still feel that something just didn't work out right in that office visit, you have the right to express your concerns, and you have a right to appeal decisions. So let's chat quickly about the complaint area. So if you have an encounter at a hospital where you feel that something didn't happen with your loved one, I mean, let's just say you walked in and you found your loved one in excretions where it looked like they had been in them for a long time. The bed had been made or whatever. That's a time where you don't wait to write a letter. You ask at that point to speak to the nursing supervisor. And let me caution you, and I'm preaching as much to myself as I am to you, that while blundering up into these situations can be very stressful, it is so important that you maintain as much composure as possible. Folks that work in hospitals are just like us, and they are human, and they demand respect as well. And many times the person that you're speaking with about the problem may have had nothing directly to do with your loved one. And yet I know you're fired up and really just, maybe this is the third time you've walked in to find this. And if that's the case, then you may need to do other things. But the first place to address that concern is right there on the spot with that nursing supervisor. Most of the time, the issue can be resolved. If you find that you have a concern about an encounter and you thought about it later after going to a doctor visit, there are many different ways to approach this. And because I'm not representing any particular hospital or healthcare plan, again, I'm just going to ask you to look on the back of your insurance card and look for that customer service number or that member service number and ask, I'd like to report a concern that I had about an encounter with my medical provider. And then that person over the phone should be able to guide you to how to do that, whether it's an online application, whether you call and someone tapes your message, or whether you have a direct phone conversation with someone about it. I will tell you that these complaints do not get thrown in the trash can. And how do I know? Because I've raised some and I've gotten phone calls back. And you might say, well, you're a doctor. No, it really doesn't matter. If you register a concern, honestly, this particular area of hospitals, they take this very seriously. And so they have to do their research. So sometimes it can take a few weeks to get back to you, but generally it's not a long time. And then from the standpoint of appeals, I speak to you about that as it relates more to denial of services. If something has been denied to you, or if something has actually been denied for payment, even, you have the right to appeal. I actually have a testimony to that as well. I had a test that was ordered some years ago. And this is what I think happened. I think because of my age, the doctor thought I was on Medicare. So the test was coded as though I was on Medicare. And with that particular code, Medicare did not cover that particular test. And so it came back to me with a big fat bill, about $500 I had to pay. It was the first time I'd ever had to pay for that test, and I had had it before. So I decided, I had a phone call to the insurance, the managed care plan, the insurance plan, about another matter one day. And they said, well, do you have anything else that's bothering you? And I said, oh, yes, as a matter of fact. And I explained the story. This had happened probably about 6 to 8 months prior. I had just given up on it. Like I said, you get tired, of just complaining all the time. And I gave the person the information and she did the research. And I explained to her I was not on Medicare. I was on my company's health plan, and that I expected that it was probably incorrectly coded because for several years I had had that test and it had always been covered under prevention. And do you know I got a big fat check in the mail about 3 months later, reimbursing me for what I paid? So, the system works if you're willing to take the time to utilize your patient rights to be able to make your health plan work for you. And now, finally, your responsibilities. So in this game of managing your healthcare and making your healthcare system and plan work best for you, there's some things you're going to have to do, and not in any particular order. You need to know and understand your insurance plan. And if you happen to be a person that changes it from time to time, you're going to need to dig in. You need to know whether you're a high deductible or not, and you need to know what that means. And if you're high deductible and you don't want to pay those high premiums, that means you need to have a little savings plan over here when it comes time. And you'll look up, I've heard family members say, oh my goodness, I've already paid $2,500 this year. What good is my healthcare plan? Well, that's what you signed up for. You signed up for a plan that said we'll kick in after X number of dollars have been paid. So you need to know your insurance plan. You need to know the needs of your family. If you have a family that's on a lot of medications, you may want to make sure you've got that plan, and with the plan that has the medication coverage. And that, of course, speaks to a whole nother area about formulary, non-formulary, and we didn't have a chance to get into that today, but that's another matter that can be addressed and can be potentially appealed. But in addition, you need to make your appointments with your doctor. Don't let anything get in the way of that. And then you need to keep the appointments. Don't let the doctor see you only when you're sick. Take your medications. And then let me say this to you. If you're not taking the medications, tell the doctor the truth. Because we're sitting here scratching our head trying to figure out why your blood pressure doesn't go down and you're just not taking the meds. But you don't want us to be, quote, mad at you. I've heard that. And so you say, well, I better let the doctor know and tell them I'm taking the medication. So then we're scratching our head. And you know what we're doing after that? We're then writing another prescription for you because we're figuring one didn't do it. Now it's time for two. Then you really think we're crazy. So take your medications, but be honest with the doctor. And all of those other soft things that we ask you to do, like exercise and eat healthy, we know you can't be perfect, but try. try, and don't ever let a situation happen where you say, well, I haven't done any walking for the last month. It's already October. This year is gone. So I may as well just wait and start in January. Start the next day. And if you don't feel like walking for 30 minutes, walk for 5. And just feel good about the 5 minutes. If you've said that you're going to give up beef and you really don't want to do it, then, set some kind of goal for yourself that's realistic. But don't set unrealistic goals, beat yourself up about it, and then just throw in the towel and say, I'll start next year. So keep in mind, this is a journey and that it's a partnership with you and your doc. And there's some things that the doc needs to do, and there's some things that you need to do. Take charge of your health. With you taking charge of your health and holding your doctors accountable, there's no other way except for you to have a positive outcome. And will you have hiccups along the way? For sure. But hopefully they will happen with you being wide open to the knowledge, you've had clear communications, you've been part of the decision-making, and you feel like you're in this as a partnership with your doctor. That ends my presentation, and I'm happy to take questions if there's time.
Yes, there's time. I see, Dr. Glenda, you're getting a lot of love and applause from the reactions of folks who are attending today. So if you want to stop sharing, there are a few questions in the chat box and the Q&A box, and then we can see what's in the chat box. But the first question is, how do you ask the question for different treatment? I think this is the patient story you told earlier about 2 patients having a very similar condition and one and the 2 of them getting different treatment plans. So can you talk about, what you do exactly? I know you said some of it had to do with the insurance plan, but how do you really navigate through that situation?
Okay. So I'm going to be really specific about this because I think it may help you. This was a situation with prostate cancer. Now, if any of you have had an opportunity to be involved in prostate cancer, I have to tell you, the treatment plan, while there is a huge menu, it's overwhelming. I mean, you really sometimes want to go to the doctor and say, just tell me what to do. What do I need to do? What's going to keep me around here the longest with the lowest risk? You really want the doctor to tell you, but I will tell you in prostate, they generally will not do that. And so this particular patient was given an option for medication, is my recollection, but a special kind of radiation beam was also an option. And it was kind of new at the time. And so the one patient had been offered the beam radiation, where you go in and get that beam. And while it was a nuisance to go, the treatment was about 5 minutes. And somebody else was getting other treatment. And actually, it hadn't even started. So these 2 men, and check this out, men talking to men about healthcare. Now, that's revolutionary. Women talk about healthcare all the time. But I was so proud of these men that were willing to share their stories. And so the patient that didn't have the option for the beam treatment went back and said to the doctor, well, I've heard this is an option. And how do I get it? And the first response was, well, we don't have it, but if you want it, you can drive 60 miles a day. But the long short of the story was that other person got that treatment and they did not have to drive 60 miles a day. Just have to be what we call, let's see, how do I call, agreeably, you have to put a little sugar with it, and you want to be kind in your ask and appropriately aggressive.
I like that term, appropriately aggressive. So the next question is, what are some of the ways that we can advocate for respectful treatment at hospitals and show knowledgeability, I guess, about what is happening with us or a condition?
So, that's a tough question, because honestly, I feel a lot of respect has to be taught in the home when you're a little bitty kid running around the house. My mother taught me, I was born and raised in the South. She said, you're going to put a handle on everybody's name that's not your age. And so for that reason, you know, I always call my patients Mrs. Jones and Mr. Jones, and I'm expecting them to call me Dr. Newell because they're not my buds. But I think, you know, we have to show respect. It's a two-way street. I don't know that you can teach another human being how to respect you. I really don't know that. But what I will say, it's sort of like a fight. You know, it's hard to fight if the other person's not willing to fight. So often when I'm in these situations, I just try to give more and more respect. Sometimes I may not be the nicest person offering my respect, but it's my way of trying to be polite to get out of the office, because then I make a decision. I'm not coming back here. It's time for me to get a different doctor. And that's another chapter in our book on how to fire your doctor, because sometimes the chemistry just doesn't work. And it is a chemistry.
Right.
So anyway, you know,
And
that's really hard to
right.
answer that, but
Yeah, and it's good to know that you have the right to actually fire a doctor and find a new one who can be a better partner or treat you with the respect and dignity and care that you need. So we do have the right to do that. Some managed care plans may, you know, be a little more restrictive, but you still can do that. So this next question is, I have to read a few things first before I get to the question. So she says, thank you for holding this very important webinar, but unfortunately, many members of our community with or without Medi-Cal have attempted some of the steps that you mentioned to further advocate for ourselves and for our community, but end up doing the advocacy or work around due to the inadequate care that still continues to be provided even after a complaint has been filed. So the question is, what suggestions do you have for patients who lodge complaints or grievance that are not thoroughly examined and or still denies the patient the right health service? Is there a next step or a higher level? Can you escalate it to, I guess, to a higher level when this actually happens?
So that's a great question, because I know we're not in a perfect world. I do think it's important that you ensure that if your concerns are not being addressed, that you carry it all the way to the president of the hospital. I mean, there's nothing wrong with you writing a letter to the president of the hospital, and you might say, oh, look, this is for an 85-year-old that doesn't have a computer and can't type. Well, you know, that's when the grandchild needs to get involved and help write that letter. But letters of communication to those that are higher up in those offices beyond the nursing supervisor, that's one way of doing it. But I'll have to tell you this, from a consumer perspective, when you're sick, it's hard to do this. And so I do encourage looking for another avenue. Why stay with a doctor that you feel, if I've got a unique disease and this is the only doctor within 1,000 miles that can fix it, then I'll just suck it up and deal with them and say, take out my whatever it is, fix my whatever it is, and I'll just have to bite my tongue to get that service and that treatment so I can move on. But really, honestly, there are many doctors in many professions out here. And so if it's a doctor situation, you can make a change. Sometimes there are problems in plans where and this is also within patients' rights, there are nursing staffing shortages that have significant impacts on your care. There are provider shortages. We've predicted when we wrote this book 10 years ago that there would be a shortage, and it's worse now than it was projected to be then. So there's so many things. So I would have to say, take your complaint all the way. You can also report it to the Department of Managed Care through the state of California. I'm sure you've heard of people saying, oh my goodness, the state rolled up in here to my office today wanting to do an audit. They follow up on things and people get caught, and then fines happen and things happen. But you know, when you're in the midst of a medical situation, it's hard to see yourself spending that kind of time. So I say on the immediate, try to get the immediate need that you have done, hopefully somewhere else. Even in the same health care plan, it can just be a different doctor. And
Right.
then hopefully spend your time to escalate it when you can.
So next question is, this is from someone who has a scleroderma and she's paying out of pocket for a specialist out of her network. She wants to know if she should fill out paperwork with her provider so that he can speak with whoever is in her network and advise them, I guess, work together as a team.
Yes. So scleroderma is an autoimmune disease that sort of falls in the family of sarcoidosis and systemic lupus erythematosus, if there are those of you that are familiar with those conditions. And those conditions are cared for by rheumatologists. Every single health plan should have at least one. Now, they are rare. I don't know why folks are not going into rheumatology, but they've been rare. It's been a rare area for many, many years. But your healthcare plan should have a rheumatologist. And yes, you should speak to your primary care provider and find out how you can get referred to the rheumatologist that is within network. Now, if you want to keep this other doctor on the side and because you like them and maybe check in with them, because people do this, and check in with them periodically to make sure that the one that's in network is providing you with the quality care that's out of network, because you can't keep affording to pay that, that's up to you. But every single plan must have a rheumatologist. And guess what? If they don't, you might be able to get them to pay for your out-of-network rheumatologist. If you push the issue, register the complaint about the difficulty to get in to see, and you are a patient that can't wait 8 months for a visit when you're having an acute problem.
Exactly. Yeah. So this next question, I think, relates to what you talked about or referred to as a center of excellence, but they want to know, how do you find out where those specialty facilities are in the areas where people live?
I'm going to say that the best place to get that information is from your primary care provider. I mean, I'm going to put in a little plug here because I serve on a lot of different boards, and I know there's a stroke center at Sutter. I mean, again, Sutter's not paying for this. And Kaiser, I'm sure, has a stroke department as well. But most of your major hospitals will have stroke centers, cardiac centers, but the best person to ask that question is your primary care provider, which speaks to the fact that every single person on this call needs to have one. And if you don't have a primary care provider, you're not even at first base. So you need to start there.
Yeah. So this next one, thank you, is an interesting question. So we know that this conversation doesn't often happen a lot of times, unfortunately, for Black patients, but are there any requirements for physicians to educate, talk to patients about available clinical trials for a particular diagnosis, illness, or health condition?
What was the verb? Are there available opportunities for doctors?
No, are requirements. Are there requirements for
requirements?
Yeah.
No, there are no requirements.
But so it's incumbent upon us as individuals, A, to become more well-informed about our health condition, but B, if we hear the words, there's nothing else I can do for you, especially if you're a cancer patient or, right, in those situations, then I guess it's incumbent upon us to ask the question, is there a clinical trial that I can participate in or available? But there's also research that an individual can do to look for a clinical trial that may be suitable for that person. But do you want to comment on that at all?
Well, yes, I will say to you that when you have unusual, extraordinary diseases, and I include cancer in that and cardiac as well, it's really great if you can go to a teaching hospital or connect some way with a teaching hospital. A teaching hospital rarely is going to ever turn you away. And they are often doing clinical trials, and they'll have that information. So seek out whatever city you live in, find the teaching hospital, go there.
And an example of a teaching hospital maybe in your area would be?
UCSF.
Okay,
San
great.
Francisco.
Okay, great.
I
think we have time for a couple more questions. I know some people had to hop to other meetings, but these are great questions, and we want to take advantage of having you with us today. And so what are some suggestions to emphasize to communities of color the importance of not being passive aggressive in communicating with their own healthcare, about their own healthcare needs? And for example, there's a habit of coping with the pain and not saying anything when someone first, I guess, they ask, how are you doing? Or it happens, but instead we wait until it's too late when our limbs are about to fall off, or, it's been quite some time since we've been dealing with this, but hesitate to say anything.
Rhonda, I have to tell you, that's a whole nother webinar.
Yes, I'm sure.
That's a whole nother webinar. I mean, that just goes so far back. I mean, the biblical scripture talks about we need to have a little suffering. I've gotten that from my own family. Well, you know, you need to have a little suffering. Well, as a physician, as many medications that are out here, I don't really want to do any suffering. But that's a whole nother webinar. I mean, you in the California Black Health Network are the first that I know of that has been willing to take this message that has been a passion of mine and my co-author for so long, and at least put it in this format for people to have access. I mean, we can use the churches to be able to share this information. We've got the barbershops, the beauty salons. We've just got to send the message wherever we know that our people are, and let them try it out and go with them to do it, because sometimes there's a feeling that doctors are intimidating. And so go in and do that communication. You tell the doctor, because it's happened all the time. Well, does so-and-so have pain? Patient said, oh no, I don't have any pain. And then the family, yes, she does. She complains about it every single night. You go there with them. You can help empower that situation and help your loved one to get what they need.
So I'm glad you said what you said, because this is a webinar that is accessible, or this series is accessible to anybody, anywhere. You don't have to live in California. You don't even have to be anybody, regardless of their persuasion, can participate and learn from this, because this is all valuable information. But I also want to say that we will be going to different communities across California to do in-community conversation sessions, meeting people where they are. So we're going to be doing a Cuts in Conversation series with barbershops and hair salons, conversation with the congregation for the faith-based community. We are going to be working with corporate ERG groups to do corporate conversations. We're going to do cocktails and conversations at Black-owned establishments for an after 5 kind of thing. So we're going to be going to a cigar bar here in Inglewood, and we've gone to a Black-owned wine bar in Sacramento. So we have to also take this to the community, even though on a webinar it's accessible to anybody. So thank you for kind of raising those things up. And I think we have, let's see, another question. What if your treatment is done by a nurse practitioner and the care that they provided caused months of my diagnosis and unnecessary medications? And even if this person complained to the physician that owns the practice, but nothing was done, like what can someone do in that situation?
So there should be no difference in care between a nurse practitioner and a doctor. Nurse practitioners are allowed to function independently. And so in other words, I'm saying there should be no excuse. If you feel that you did not get proper care, you need to register that concern to the office, and then you may need to take other measures. First of all, get yourself to another place where you can get care. And then there are other ways that you might be able to address this through legal engagement.
Yeah, and then this last question is, how can you communicate with your doctor if you don't want to take or start a medication or take other drugs, I guess, to handle the side effects of maybe one drug?
Yeah, well, again, it's a partnership. You know, the doctor knows a lot about the medicine, but you don't. And so sometimes you just need the time to process it. You need the time to. So I would just say in the calmest of voice, doctor, could you just give me like a week or two to just kind of research this and think about it? I know that you have my best interests at hand. What other options do I have? But could I just take the time to just do a little bit? And if the doctor is intimidated and feels like, well, they're not following my rules, you're going to pick up on that later, and that's going to make you go look for another doctor. But it's a partnership. It just should never be, you know, my way or the highway. That just doesn't work. Maybe that worked back in the 50s. It doesn't work now.
Great. Well, thank you so much, Dr. Glenda. This was amazing. You're amazing. And I'm so happy that you're part of this series. I just have a few last minute things to share before we officially end today. But for those of you who are still on the webinar, we would love to get your feedback on today's session. So if you can scan the QR code here and fill out the evaluation form, we would love to hear from you and get your feedback. We'll also send a follow-up just in case people who had to leave early missed seeing this. So you'll have 2 opportunities to provide feedback today. And also want to remind everybody, if you enjoyed the conversation today and hearing Dr. Glenda, we've got 4 more sessions with her between now and November. The next one is August the 8th, and that'll be how to communicate with your healthcare provider. So some of the questions that came up today kind of touch upon this. And I think there's a way that we can do that effectively and diplomatically and compassionately without it escalating into someone calling security, because we're trying to advocate for ourselves or speak and amplify our voice and concerns. We also have an in-community conversation session on August the 9th in Stockton, and that one specifically is going to be focused on breastfeeding. So that is part of National Breastfeeding Week. And so we'll be doing an in-community event that's specifically focused on how do you navigate through that situation, especially if you are given birth and you want to breastfeed, but people are trying to persuade you and direct you to actually formula, but you know what you want for yourself and your baby. So we're going to be talking about how do you navigate through that situation, communicate with the medical team and provider that's trying to stir you in a different direction from where you want to go. And so with that, last thing I'll say is you can follow us, you can keep up with what we're doing on social media and also on our website. You can join the campaign for Black Health Equity and become part of that, or become a member of the Black Health Network. All of that is accessible via our website, which is www.cablackhealthnetwork.org. Thank you so much for being here today. We hope you enjoyed the information that was shared and the message that Dr. Glenda had to share today. And we look forward to seeing you on August the 8th. So have a great afternoon. Thank you so much.